going to be doing two different procedural medications for ophthalmic ointment and for ophthalmic drops. So first, I'm going to check the patient's medication administration record before going to bedside, and then remove the medication from the medication distribution system and to ensure I have the appropriate medication. Then I'm going to go into the patient's room, introduce myself, inform the washing my hands. Then I'm going to place the medication at bedside. Then I'm going to access the medication administration record and then ask the patient for two forms of identification and do a medication check to confirm it's the right drug with the right patient. And also I'm going to ask the patient if they have any allergies to any medication. And to begin, I'm going to place the patient in a supine position with their head hyperextended. And then I'm going to wet a warm washcloth to remove any excess crust from the patient's eyes. Then I am going to pull down the conjunctival sac and have the patient tilt their head backward. Next, I'm going to apply the medication ointment to the patient's conjunctival sac, moving from the inner to outer canthus, being sure not to touch the medication administration device directly to the patient's eye, as it could cause cross-contamination when used again. Then I'm going to have the patient blink their eyes gently to distribute the medication, and then I am going to wipe the excess medication away from the eye. Next, to move on to administering ophthalmic eye drops, I'm going to check the medication administration record before going to bedside, remove the medication from the medication distribution system, and check that I have the right drug. Then I'm going to go to the patient's bedside, identify myself, and perform hand hygiene and put the medication at bedside. Next, I'm going to access the medication administration record and identify the patient with two forms of identification to check that I have the right drug in the right dose in the right patient, and that's when I'm going to be doing my medication check. And then I'm also going to ask the patient if they have any allergies to any medication. Next, I'm going to have the patient tilted in a supine position with their head hyperextended. Then I'm going to get a warm, moist washcloth and wipe away excess crust from the eyes before medication administration. Next, I'm going to place a tissue on the cheek directly below the eyelid to collect excess medication that may spill out of the eye during administration. Then I'm going to pull down the conjunctival sac and have the patient tilt their head upward. Then I'm going to apply the correct number of drops to the patient's conjunctival sac. Then I'm going to have to then blink their eye gently to distribute the medication throughout the eye. Then I'm going to blot the excess medication with the tissue. Thank you.